Hello, everyone. Welcome to Friday. It's finally Friday, as Bailey Major says. I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today's Friday, August 27th. We're going to have sort of a special COVID update today. I'm going to talk about COVID, and then Aaron Coker is going to talk about IDA. So it's our Anyway, okay, today we have a cumulative number of COVID cases at 62,230. 446 cases were added yesterday. The cumulative number of patients who have died with COVID is 1,015. 8 additional deaths were reported to us yesterday. And the cumulative number of people hospitalized with COVID-19 is at 7,702. 14 new admissions were recorded yesterday. The number of people in the hospital yesterday is 429. That was up just slightly from the day before. So as we've been talking about, we've been sitting in between the, the 420s, 30s, 40s, 50s for some time now. We hope that we will stay in the 20s and we'll continue to see a reduction in the number of people hospitalized. So before I talk about some school reporting and address any media questions having to do with COVID, Aaron Coker, our Emergency Preparedness Director, is going to come and talk to you about information on IDA and preparation for IDA. Aaron?
All right. Hey, everyone. Let me get these off here. All right, I'm Erin Coker, the Emergency Preparedness Administrator for the Mobile County Health Department. Just wanted to kind of provide you some updates on what Hurricane Ida is looking like right now. So since our 11 o'clock briefing, it has been upgraded to a Category 1 storm. It is expected to impact the Gulf Coast. Right now, we're looking at a landfall a little bit west of New Orleans, but that does not put the Mobile area out of danger. So just keep in mind that even though Mobile is not in the cone, we still will have some impacts from this storm because we are on the east side of the storm, which is not the good side. So just as a reminder, we want to encourage you to have personal plans together. We want you to start looking at areas outside of the cone that you could potentially evacuate to if you have friends in Florida. Please try to go that way. Go east on I-10, go down towards Tallahassee, towards Orlando. That direction is not going to be impacted by this storm at all. If you've been watching the news, you'll kind of see that this storm is going to go up over Louisiana and kind of loop back to the east over Alabama. So we do not want to encourage you to go north. If you can, go east and just work on those personal plans and always use shelters as a last resort. With our increase in cases of COVID, we are really trying to encourage people to not come to shelters unless you absolutely have to. We are working with the Mobile County Emergency Management Agency on those plans. At this time, we have not made any final plans to open shelters. Always just keep an eye on MCHD's social media. We do publish news releases, and then, of course, it will go to all the media outlets. As a reminder, I wanted to encourage you to get those top 10 things together that you need if we do have to evacuate or if you decide to shelter in place. Of course, you want to have enough water for everybody in your house. They recommend at least a gallon a day per person. Any non-perishable foods, a manual can opener for those foods. Get some of your extra medications together. Have those on, in a little bag that you can just grab and go. A first aid kit, flashlights with extra batteries, radios with extra batteries, specifically a weather radio so that you can get those updates, extra changes of clothes, your personal items, so your toothbrush, sanitary items, different things like that, and then any important documents that you may have if you do have to evacuate so you can identify yourself. If we do open a medical needs shelter, just as a reminder, those are for patients that have minor medical needs. They may have equipment that is electricity dependent, like a CPAP or a ventilator or something along those lines, an oxygen machine. And then you also have to bring a caregiver with you. That caregiver has to be at least 18 years of age or older. If you come with your family, we will assess the entire family. We are looking at different ways to protect folks that come in due to COVID. So if we decide to open a shelter, just keep in mind that medical needs is for those that absolutely need it. Mark is going to publish a link and that link is going to show you what the storm surge areas are in Mobile County. So I think it should be published now if you're watching. And if you will, click on that link, and if you are in any of those areas that show red, please consider evacuating that area and going to stay with family members that are outside of that area. Those areas in red are going to be the areas that have the highest potential for flooding. Just kind of watching what the storm's going to do. Is predicted to make landfall as a Category 3 and then stay a Category 2 once it's over land for a decent amount of time. So if that happens, and us being on that east side, we could potentially have a lot of rain that comes into the bay. So please watch those areas and look at that information that Mark has posted. If you have any questions for us, don't hesitate to reach out to the social media websites. I'm happy to answer any questions that you may have. Until then, please stay safe and keep watch on all the outlets for any additional information that may be coming. So thank you and have a good day.
Thank you, Erin. And just one addendum to Erin's remarks. Our New Bern Health Center COVID clinics will be closed Saturday and Sunday, partly because we don't want people to be out in the weather and bad weather, and partly because our staff are being diverted to prepare for potential impacts of Hurricane Ida. So we will not have our COVID testing and vaccination at the New Bern Health Center Saturday or Sunday, and the family health clinic at our downtown Keeler location will be open to receive people with appointments as usual on a Saturday between 8 and noon. Anything else about that, Mark, that you think I should say? Okay. All right. So again, have those top 10 things that you need if you have to evacuate suddenly, if the storm should take a different direction. If you are already in a surge area, please make preparations to go ahead and move to areas that are less prone to flooding and are out of the path of the storm. So back to the COVID part of our COVID update. Couple of questions. I've not looked at these. It's been a really busy day, but I'll do my best to answer them. Someone asking if we've seen an increase in poison cases due to the use of ivermectin. Yes, the calls to the Alabama Poison Center have more than doubled because of people taking ivermectin that is intended for animals, and it's intended for horses and cows, not people. So unfortunately, that puts people into a dangerous poisoning situation, and the calls to the Poison Center have gone up. So please do not take a drug or a therapeutic that is intended for animals. Let's see. What kind of protocols are in place during hurricane or tropical storm? We've already talked about that. Again, congregate setting or congregate living is really dangerous right now because COVID transmission is so high. So we want you to prepare an alternate lodging situation. Don't depend on a shelter. Please look for friends, family, hotels that you can go to, because if we do have to open a shelter, it will be very important that we try to keep it COVID-free and also take care of people that show up. So it's not a good situation. So as Erin stated, a shelter should be your absolute last resort. Let's see. What kind of tips do we suggest to keep you safe from COVID during a hurricane? So in addition to that top 10 list that Erin talked about, we want to make sure that if you do evacuate to someplace else, that you take hand sanitizers, that you take several masks, keep your family units together, try to distance yourself if you are waiting in line for gas or for water or for, waiting to be admitted to an alternate lodging location. So again, add those things to your Hurricane Go kit to help protect you from COVID during the storm. Let's see, someone asking, could the slightly lower infection rate, talking about COVID infection rates, I think they're talking about the slightly lower percent positive be a result of more people doing at-home tests that aren't reported? It's possible, but um, again, what we do with surveillance is not to try to capture every single data point, but to try to look at things that are representative of what's going on in our community. So the fact that it's going down, I think, means that COVID transmission right now is going down slightly in our community. Again, it's still up around 26%, and in June we were, 3%. So it's still an extraordinary high number of percent, or a high percent positive, but it is moving in the right direction. Can a vaccinated person receive monoclonal antibody treatment if diagnosed with COVID-19? So discuss this with your physician. It depends a little bit on sort of the timing, your risk factors, if you're suitable for monoclonal antibody treatment, that sort of thing. Does the 15-minute close contact rule still apply with the Delta variant? Yes. So far, CDC has not changed their definition of close contact, even with the Delta variant being, 95% of the cases that we see around the U.S. So right now, it's still 15 minutes within 6 feet. Someone asking, again, I think this probably same viewer, wanting to know what we can do to protect our children. Again, the best thing we can do to protect our children from COVID is to get anyone who's around them vaccinated. So put a ring of vaccination around them, parents, babysitters, teachers, grandparents, aunts and uncles, siblings that are old enough to be vaccinated. Make sure that they wear a mask if they're, over the age of 2, and distance from people that they don't know. Can I add how many have had the vaccine out of this and unvaccinated on the daily chart? We do not have the percent vaccinated and unvaccinated on the daily chart. I'm trying to think where that might be publicly. In general, 85% of hospitalizations are occurring in unvaccinated people, and 95% of hospitalizations are occurring in unvaccinated people. So if you want to take the number and multiply it, you'll know. So yesterday, 429 people were in the 95% of deaths are unvaccinated.
Yeah, you said hospital.
Oh, sorry. 85% of hospital people in the hospital, 85% of them are unvaccinated. And people who die with COVID, 95% of them are unvaccinated. So if you take the 429 that were in the hospital, multiply that times 0.85, and that will give you, I can't do that math in my head today, probably not most days, but that'll give you an idea about the split. We are looking at, I think today Mark sent out a new graphic to try to, make it a little bit simple, put out some of this information in a little bit more bite-sized pieces. So I'll see if we can come up with a number vaccinated, number unvaccinated for you for hospitalized and deaths, maybe sometime next week. All right, I think that's it. Yep, that's all. Oh, that's right. Thank you, Mark. So sorry. So we've been getting some questions about, are schools required to report COVID cases? What are their requirements? I mentioned a couple of days ago that anyone in Alabama that knows of a patient with COVID is required by law to report that to the state health department using the report card. Schools have their own report card. So schools are, if they know of a COVID positive, are required by law to report that to the state health department. The Alabama State Department of Education is re-implementing voluntary, it's requested, but they're re-implementing the same reporting that they had last year. So local education agencies are requested to enter the number of new COVID-19 cases among students and employees of which they are aware on a weekly basis. So the COVID-19 K through 12 dashboard is back up. This week is a test week, and only about 52 schools out of 143 school districts are reporting. And remember, it's the school district, the local education agency, that is requested to enter this information. So they report it to the Department of Education, and then the Alabama Department of Public Health is supporting that effort by displaying that data on the alabamapublichealth.gov website. If you go to the dashboard, the COVID dashboard, you'll see the tab there for school reporting. So again, this is voluntary reporting, but it's requested of every LEA, local education agency. And we don't verify the data. The accuracy of the information that is provided is not checked, but it's weekly reporting. So, but at least it is some information that will be made available to the public, and it depends again on the local school systems to put that in. Just trying to read if there's anything else. It also says that if a school reports COVID cases in students or staff, it doesn't necessarily mean that COVID case was contracted at the school itself. That's very hard to tease out, particularly when we are in a situation of having so much COVID transmission around the community. Okay.
Would that be double reporting?
So this is different. So what is the reporting that's done by the local education agencies, that is aggregate reporting. So they just report, we have 10 cases or 5 cases. The school report card is an individual basis. So using the report card, a school would report Randy Murphy has COVID, Mark Bryant has COVID, Johnny Appleseed has COVID, right? So it's two totally different reporting mechanisms, and really they have two purposes. They are never going to match. So, but again, just additional sources of information. Anything else, Mark? Okay. All right. So please pay attention to the weather. Watch what is happening with Ida. Making landfall as a Category 3 is a very serious storm, a serious situation. So please, be aware of your surroundings. Do not cross a street if it has water over it, because you never know how deep that puddle could be. And prepare a kit in case the storm moves in a different direction in the last, day or so. Turn your radios on, pack your things, and be ready to evacuate to keep yourself out of harm's way. And add those personal hygiene things, masks, hand sanitizer to your go kit to protect yourself should you find yourself in an area with people that you don't know as you are escaping the storm or a water surge. So that's it for today. Please stay safe this weekend. Get vaccinated, wear your mask, distance, and stay at home if you're sick. And we will talk to you next week.